My name is Davie Khuoge. I'm a nursing officer from Malawi, Southern Africa. I'm doing a Merck Oncology training program here in India at Tata Memorial Hospital. I got recommended by the Malawi Ministry of Health through the office of the First Lady. Malawi is facing a lot of challenges in terms of cancer treatment, starting from primary, secondary, tertiary, and going up. And most of the challenges are due to lack of skilled expertise, lack of health centers, hospitals, and specialized treatment units. So until a number of years ago, maybe 2 years, the hospital that I work with, which is Kamuzu Central Hospital, and Malawi government opened a first and the only cancer center in Malawi. So this one is covering a number of people. It covers, I think, about 8 districts in Malawi that are surrounding the hospital. And of course, the whole Malawi has, this is the only center where cancer patients are treated. So this has been a challenge because people have to move all walks of life in Malawi just to come to the capital Lilongwe to access cancer treatment. So this is a major challenge for healthcare delivery system. And another challenge is on lack of expertise in cancer. That's to do with doctors and nurses. We have a challenge in nurses. Like myself, I think in my field where I work, because I'm much more in operating room nursing, I'll be the first one to graduate through this program. And that's a challenge. We're talking of a country that has about 19 million people, and then we don't have enough skilled personnel to do the job on the ground. So yeah, there are a number of challenges, and if you look at the numbers, Malawi, I think, is among the top countries that have a number of cases. The prevalence is just so high in Malawi, and of course in a number of African countries, but Malawi should be in the top 5. So this is a big challenge. Yes. I believe that these challenges can be dealt with by having enough trained personnel, and also having enough hospitals just opened just to treat cancer patients. As I speak at the moment, I think we only have, like in my case, we only have 1 surgical oncologist, and that's not even enough. So I think if we have a good number of such expertise, it will be better. And the other thing is on nurses. You need to train, I think, more nurses into this, and should also move more emphasis into preventive measures. Unlike in other areas, but in Malawi, there is a tendency where people would always go to the hospital when they are sick. So that would be another thing that need to be worked on. And this training is so much important to me personally as an individual, as it will open much more career paths through my journey, and also to the hospital that I work with, since we have a new cancer center, and previously we didn't have trained personnel to look at some cases that keep on coming, and there are so many of them. So this will be important to the hospital. They would raise my skills, and I will also deliver what I have learned through the program. To the country, this will be much important as well. That the country is working tirelessly to boost the country's health system, which meet a number of challenges. Well, coming into this program, I had a number of expectations, so many of them. Malawi is lagging behind in terms of technology. That's the first thing. Secondly, the health delivery system in Malawi is not that good. I should be honest. So coming into this program, I knew that I would learn a lot of things, and I have really learned a lot of things, which I believe would make a difference when I go home. There are a number of advancements that are being made. Of course, some they are using modern technologies, which maybe Malawi may not achieve at the meantime. But there are a number of things that we can do a lesson from them, and we can work towards it. Also on diagnostics, I think Malawi is so lacking behind on that, and that's an area that we can work on that when I go back home. I'm also looking forward to team up with the team that also attended the same program, so that we can work together and have our own goals set and achieve them. So this program has exposed me to a lot of areas, starting from preventive oncology. So there are a number of things that are done here which we don't do in our country, but they are not that expensive, or they are not that sophisticated that we cannot do. I observed a lot of things. We'll talk of colposcopies, VIA, and the way we do back home, I think needs some improvements, which I believe that when we go back home, we'll be able to do that. Moving that, in terms of treatment, surgical treatment here is a bit advanced, but it's not that sophisticated. Like for instance, we do laparoscopic surgeries, which also they do here, a lot of them. Maybe the only thing that we may not be doing are robotic surgeries, but maybe in the near future we'll be doing that. But in the meantime, I think the most common things are preventive and treatment of cancers, which I believe that we'll draw a lesson from them. So upon going back home, I, as a nurse, I intend to open up a surgical oncology clinic with the help of doctors and the other team. I would also like to have a theater day where I would be conducting surgeries that are related to oncology. So there are a number of things that are being done to the program, and thanks to Merck Foundation for that. The outline of the course is quite good, and it catches almost a number of things. However, I believe that the duration of the program may need some adjustments, so that a lot of things is being covered. There may be some limitations in some areas due to limited time. So I think time can be adjusted for the program. I would like to thank Merck Foundation for the opportunity they gave me. They were so professional. Their goals were clearly set, which tallied with my objectives and the objectives of the country I'm coming from. This program will not just benefit myself, to benefit myself, the government of Malawi, and the hospital, Central Hospital, which I work with. Malawi.